Hello, my name is Melissa Jarrett. I'm an Indiana State University nursing student, and welcome to my educational presentation for prevention of heart disease in women, promotion of a healthier community. Before we get started in the presentation, please take a few minutes to test your knowledge by following the link below before continuing to the remainder of the educational topic. Learning objectives for this presentation are as follows. Define heart disease. 2. List factors that contribute to heart disease in women in the community. 3. Identify lifestyle risk factors for heart disease. 4. List the signs and symptoms of heart disease in women. 5. Identify community resources for screening and treatment for heart disease for women. And 6. List lifestyle changes and preventative measures for heart disease. What is heart disease? According to the CDC, heart disease may refer to many different heart conditions. Some of those are as follows. Coronary artery disease, or CAD, is where the blood flow to the heart is compromised. Heart attack is a condition in which the heart is suffering from muscle death and is unable to maintain rhythm needed to sustain life. Heart failure. Heart is unable to pump the blood sufficiently to meet the body's needs. And arrhythmia. The rhythm of the heart is insufficient to sustain blood flow through the body. So why are women at risk? According to the CDC, heart disease is the leading cause of death for women in the United States, killing 299,578 women in 2017, or about 1 in every 5 female deaths. Heart disease is the leading cause of death for African American and white women in the United States. Among American Indian and Alaskan Native women, heart disease and cancer roughly the same number of deaths each year. For Hispanic and Asian or Pacific Islander women, heart disease is second only to cancer as cause of death. About 1 in 16 women aged 20 to older, or 6.2%, have coronary artery disease, the most common type of heart disease. About 1 in 16 white women, Black women, and Hispanic women, and about 1 in 30 Asian women. Some of the leading causes for death in women when it comes to heart disease are arrhythmias with the abnormal heartbeat, clogged arteries often seen with coronary artery disease, and heart failure. About 1 in 3 women in the United States lives with heart disease. Women also have a higher lifetime risk of stroke than men. 44 million women in the U.S. are affected with heart diseases. 64% of women who die suddenly of coronary heart disease have no previous symptoms, and 80% of heart disease and stroke events may be prevented by lifestyle changes and education. Lifestyle choices matter. Heart disease risk factors are listed as follows. Diabetes, being overweight, an unhealthy diet, having no physical activity, using or abusing alcohol, and smoking tobacco. Some recommended steps to a healthier heart are listed here. Live smoke-free, monitor your blood pressure, maintain a healthy weight, watch your cholesterol, control your blood sugar, get active, and eat a heart-healthy diet. Major heart attack signs and symptoms in men and women can differ. Both may have chest pain or discomfort. Both may experience shortness of breath. Both may complain of pain or discomfort in the jaw, neck, back, arm, or shoulder. But women usually report feeling nauseous, lightheaded, or unusually tired. Signs and symptoms of a heart attack in women could be any of the following: chest pain, pain in the neck, jaw, or throat, pain in the abdomen or back, nausea, vomiting, fatigue, or tiredness. Women in heart failure may experience any of the following: difficulty breathing, harder time breathing when laying down, excessive weight gain with swelling in the feet, legs, ankles, or stomach, and feeling of fatigue or tired. Treatment for a heart attack can include exercise regimen changes, lifestyle changes, and cardiac rehabilitation, which includes exercise plans, medication education, diet modifications, smoking cessation, and counseling. Treatment for heart failure can include medication regimens, low sodium diets, restrictions of fluids, heart transplants or surgeries, and daily exercise regimens. Some prevention interventions for a healthier community are as follows. Provide free community screenings for cholesterol and diabetes. Encourage management of pre-existing conditions such as diabetes and hypertension. Promote healthy choices with education in diet, exercise, and smoking cessation. Educate communities with free access to community resources and data across all language barriers and cultures. And watch for signs and symptoms of heart disease in women in everyday practice and treatment in the community. A list of community resources has been provided. Please take a few minutes to complete the post-test as the educational module is complete. Thank you so much for your time, and I appreciate all of your attention.